How many vaccines would you say an average woman who is maybe 25 gets from 0 to 25 years of age, roughly?
Roughly, let's see, from birth to 25. Most of the vaccines you get when you're before you turn a year old. You're in the hospital. You get the babies. They get the MMR, measles, mumps, rubella vaccine. They get the polio vaccine. They get a smallpox vaccine. They get a let's see, there's another common vaccine that they get, pertussis. They get a pertussis vaccine. And generally that's in the first few years of life, and then they get booster shots later on. The pediatrician can answer that better than I can, because, I just know they get a lot of vaccines.
Okay, all right, that's fair. Okay, so on to the next question. I have gestational diabetes. Should I get the vaccine?
Absolutely, without a doubt, should get the vaccine. Women with, or people in general with diabetes, high blood pressure, mitigating factors, and lung disease should all get the vaccine. It's recommended by all the agencies that I mentioned earlier. There's no contraindication. There are a few contraindications of getting the vaccine. People that have had anaphylactic reactions to vaccines in the past, or people that have had other types of vaccine-related, which aren't many, vaccine-related side effects. And, people get side effects to all kinds of vaccines. They get side effects from the flu vaccine, from the Tdap, but they're minor. Okay. But again, there's in fact people that are immunocompromised or have severe medical issues that compromise their immune system. Yeah, they should get the vaccine sooner than later.
All right. So this question, now you touched upon this a bit, does the COVID-19 disease or coronavirus impact pregnant women more than non-pregnant women? If so, how?
Absolutely. Pregnant women, and this is from my experience, but also from what the literature says, they have 2 to 3 times the chance of getting severe illness behind the COVID. But don't know why, but pregnant women are more severely affected by the COVID. But that's why they end up in the ICUs, in the hospitals, because there's something about that pregnancy that makes their severity of the illness, it accentuates the illness. So you see more pregnant women ending up in the hospital and in the ICUs than you do non-pregnant women. And generally, the illnesses are related to a respiratory system. For some reason, it attacks the lungs. I've seen X-rays of women, pregnant women, with COVID, and it's like what we call a whiteout of their lungs. Their lungs, they get a reaction to it, whereby it's severe inflammation, whereby the lungs start producing fluid. In other words, they're drowning, produce a lot of fluid. And so the alveoli cannot transfer oxygen to the bloodstream. And that's why you read about people in the ICUs on oxygen. You read about countries that don't have oxygen, where women die, or people with COVID die because of the lack of oxygen. They can't breathe, is what it is. The only thing we can treat women with is anti-inflammatories, but primarily oxygen, keeping their oxygen levels up. The oxygen saturation drops very low. Like normal saturation, you and I, is probably around 90, 95 to 98. But pregnant women, I've seen PO2s down in the 70s. In other words, they can't breathe. And all we can do is just support them. But that's why the big emphasis is on keeping ICU beds open, because these women, for the most part, require ICUs.
And when the breathing capacity goes down for a pregnant woman, how does that impact the baby?
Well, if the mother's not breathing, we've seen, we monitor women when they're pregnant or when they're in labor. And when they're in labor, we monitor their oxygen saturation, and we monitor indirectly monitoring the baby's oxygenation. And if the mother's not getting oxygen, the baby's not going to get oxygen. Their saturation goes down, and we get to a point sometimes that the mothers are seriously ill, where we have to take the baby early.
Okay.
Because you see on the monitor, the fetal monitoring, that the baby has what we call deceleration, severe decelerations, and that's usually there because of their acid base levels, and they can't breathe either. The mother's not breathing; she's not delivering oxygen to her placenta, and the placenta is not delivering oxygen to the baby system. So yeah, it's severe.
Okay, the next question. If I get COVID-19 when I'm pregnant, will my baby have COVID when I deliver?
No, absolutely not. They monitor that also. They've studied that, mothers with COVID, and absolutely not. But if a mother gets the vaccine while she's pregnant, there are levels of detected of the antibodies in the umbilical cord and in the baby. So they're kind of protected also.
Okay, so the baby will have some protection against COVID-19.
Yeah, okay. Yeah, the baby has antibodies, yeah. Or the mother antibodies, yeah.
All right. Now, this question is more about your experience. Now, you have been talking about being a practitioner during the pandemic, but over the past 18 months, what would you say you've learned the most about pregnancy, pregnant women, and this pandemic? Any insights, any epiphanies?
Yeah. It's amazing how gullible some people are, not necessarily women, people in general, especially African Americans. And if it's on the internet, as I was saying, it's true. You know, I get all kinds of questions, like I'm afraid to get it, and I'm afraid it might change my DNA. That is false. Messenger mRNA, the vaccine, neither. Any of them, the three of them, they don't have anything to do with DNA. They don't enter your DNA. But that's the big thing right there, is people say, it's gonna alter my DNA. It's gonna magnetize me, because there's magnets in the vaccine, which is false. I'm getting, as we talked about, I'm gonna be sterile, or I'm gonna be infertile if I get.
Dr. Allen.
One, I recommend COVID vaccine to all my patients, pregnant or non-patients. I recommend that their families get vaccinated, pregnant or non-pregnant. I recommend that they use safety precautions. As I was saying, my patient that died, she had been to her sister's house, and no one was wearing a mask, or no one seemed like they were taking this whole thing seriously, because it was an indoor event and there were a number of people there. So I tell patients, just kind of like watch where you're going. Watch it, if you don't be ashamed of wearing a mask, even if you're among family and friends, because, COVID is serious business. Lessons learned. It doesn't matter what vaccine you get. If you can get the vaccine, get it. Again, that's for pregnant or just people in general should get it, and encourage your family, friends, or people you're going to be around to get vaccines. If you're going to an event such as a wedding or even church for that matter, if people aren't vaccinated and they aren't wearing masks, then you don't need to be there, because you don't know. COVID doesn't have anything you can see. It's there. It's spread by viral particles in the air, and you don't know who has it, who's singing, if they have it or what have you, and they're projecting their viruses out. Because this variant of the vaccine is more deadly than the original. Of the COVID virus is more deadly than the original virus, and it's more easily transmitted.
Have you seen an increase in pregnant women coming down with COVID or needing to be admitted?
Well, initially, yes, but that's in Sacramento anyway. Those numbers are going down. I think it's probably because more women are being vaccinated, and the numbers in general are going down here in Sacramento County. Our ICUs aren't as full. They've got, any number of ICU beds at our hospitals that are open. So they've started to ease up on the mandates up here.
Okay.
So yeah, it's something to be taken seriously. And again, even though our ICUs aren't full, there was a time when at my hospital where I'd come to work in the evening or in the morning, and our ambulance bays were full. Just full, and you walk into the emergency room and they're just ton of people there with COVID symptoms. But that has since gone down.
You were saying the numbers have been going down in terms of pregnant women being admitted into the ICU. So your beds are looking much better than they were before.
Yeah, definitely dropping noticeably. And, plus they keep track of the numbers in the newspaper every day, because they look at all the hospitals, and our county officers, county health officer, and Dr. Kasiri, and she keeps everybody up to date as to what our numbers are looking like, whether they're going up or whether they're going down. And unfortunately, there are certain areas, certain counties around here that don't believe in vaccine, don't believe in masks, and their numbers are staying up.